Hi there, it's Benny. This is topic 4, community resources. Care doesn't end at discharge. So I chose this topic because one of the biggest things I learned during my mental health placement was that a patient's recovery doesn't stop when they're discharged from the hospital. And then while we focus a lot on the care during admission, I realized that what happens after discharge can be just as important. Many people return home still facing challenges with medication adherence, access to community resources, housing, employment, or just ongoing mental health support. And it just really made me appreciate how important the continuity of care is in helping people maintain recovery and just avoid readmission to the hospital. The first article by Von Draz looked at the continuity of care programs for adults who presented to the hospital with specifically suicidal thoughts or suicide attempts. And then sort of instead of just simply giving the patients a list of community resources, trained mental health professionals connected them directly to services before they left the hospital through, like the authors call this a warm handoff. And they found that significant reductions in like suicide attempts or like readmissions just because of this. And it just reinforced for me that helping someone navigate the healthcare system can be just as important as treating them while they are admitted. And then the second article by Mudavaki and et al. Just focuses on the transitional nursing care for people living with severe mental illness. So participants received psychoeducation before discharge, and then they received a home visit after leaving the hospital, also having regular follow-up phone calls. And then compared with usual care, they experienced improved medication adherence and better daily function and reduced symptom severity. And just overall a greater progress in their recovery. Basically, this article has shown me that the nurses can continue to make a meaningful difference even after the patient has been discharged, and just sort of supporting their integration back into the community. And then looking at this through a relational inquiry lens, I realized that discharge is not the end of therapeutic relationships. Rather, we should be encouraging nurses to consider the broader context of the person's life, including like who their relationships are and who are their available supports and like maybe what are their barriers to accessing care. And then just not assuming that a patient will be able to manage on their own after discharge. We should be working collaboratively with the patient's families and the patient themselves and the community resource centers that we have available to ensure a safe and successful transition for them. One lingering question I have is that we are often short-staffed and have limited community resources. And like even though we know what the patient needs, I just wonder how we can consistently sort of bridge those gaps that we have and shortages, and just advocate for better services for them after discharge. Overall, yeah, this topic just reinforced that good nursing care extends beyond the walls of the hospital. And just basically, as I continue working towards becoming a nurse, I just hope to remember that discharge isn't the end all be all of the patient's journey. Like there is more afterwards that we just maybe don't even see. And just supporting their transition back into the community is just as important as their stay in the hospital.